The following portion of Bloom is sponsored by Gulfside Healthcare Services.
Welcome back to Bloom. Peace and comfort alongside quality medical care and emotional support is crucial in helping a family whose loved one has an illness that's progressed to end stages. Gulfside Healthcare Services offers a continuum of care, allowing you to stay in your own home while receiving expert care. Here to tell us more is their president and CEO, Linda Ward, and Chief Medical Officer, Lisa Barker. Ladies, thank you so much for being here.
Thank you for having us.
So Linda, we'll start with you. Tell us about the history of Gulfside. How long have you been serving Tampa Bay?
Well, Gulfside started in 1988 by a nurse and a physician, a community leader that just really wanted to provide quality of care. It started in Newport Richey and remained very, very small for a number of years until we really were able to develop this concept of care to reach everyone in their homes and beyond for services that would be needed. And so we started growing and serving hospitals and assisted living facilities and nursing homes and going into people's home. That's really what Gulfside specializes. That's really the concept of hospice care, and I think Dr. Barker will go into some of that for you too. But since then, we've grown to serving over 650 hospice patients, and then we have a palliative care program, which is for chronically ill people that are just really challenged with chronic illness, pain and symptom management. And then about 5.5 years ago, we opened a skilled home health and rehab division. So that's that continuum of care. So coming into the Gulfside family of services, wherever you are and whatever needs you have, Gulfside can provide that care to you.
And I love that. I love the continuum of care, because we were talking about this during the break, that I was dealing with this all alone. And you want to provide the best for your family, but you sometimes don't know what to do and when these stages should come, right?
Right. Well, and the continuum of care that Gulfside offers is very expansive. And with our home health division, our palliative care division, and our hospice division, we really can help people along multiple places within their illness trajectory. And that's not always a linear progression. Sometimes patients move back and forth between those different service lines that we offer. So say, for instance, we have a patient who's getting acute rehab with our home health. They can also receive palliative care services at the same time. And along with that, then we can also, when the patient's illness has progressed to the point that they are of a life expectancy that's appropriate for hospice care, we can transition them to that. Sometimes they get better and we transition them back to another service line.
Yeah. And Dr. Barker, talk to me a little bit more about some common myths about hospice.
There are a lot of myths about hospice. One of the main ones is that hospice is only for the last days of life. And we know that we bring patients onto hospice care earlier and can really focus on the quality of their life and help them with planning their last days, that they often will survive longer when they stop those aggressive treatments. So that's a common myth about hospice care. Another myth about hospice care is that it's only for the elderly. We have patients of all age ranges on our hospice, even pediatric patients that we can take care of. Another myth is that hospice care is expensive, where it's actually paid for by Medicare and is fully covered, along with Medicaid, and most private insurances have a hospice benefit. Hospice is not only for cancer, which is another very common myth. Nationally, only about 35 to 40% of hospice patients have a primary cancer diagnosis. So we take care of all sorts of different illnesses.
It's incredible what you guys do, and I read a whole book about hospice and how much it helps, and like you mentioned, the longevity that it adds to a patient's life. And so to find out more about Gulfside Hospice and other services available, visit gulfside.org or call 1-800-561-4883, 7 days a week, 24 hours a day. And we're so excited to have Gulfside Healthcare Services participating in our Bloom Family Fitness and Health Expo happening Saturday, March 1st from 9 a.m. to 1 p.m. inside the Tampa Bay Buccaneer Advent Health Training Center. We hope to see you there. We'll be right back.
The preceding portion of Bloom was sponsored by Gulfside Healthcare Services.